Assalamualaikum warahmatullahi wabarakatuh. First of all, we would like to say thank you for the opportunity giving us to present our paper on the second BOROBUDUR International Symposium on Multidisciplinary Studies. My name is Fahrun Roshid from School of Nursing, University of Muhammadiyah, Surakarta. Our paper title is The Effects of Oral Supplementation of Bitter Melon Leaves Extract on the VEGF serum level in diabetic foot ulcers, randomized control trial. Background: the more increasing prevalence of diabetic mellitus can escalate the incidence of DFU, cause complication in organ systems irreversible in both the parenchyma structure and peripheral structure. DFU and amputation are the most common complications. This is the main cause for non-traumatic foot amputations, thus significantly causing disability, morbidity, and mortality. It also causes the significant physical, psychological, and financial burdens. Diabetic foot ulcers increases the apoptosis of fibroblast cells, decreases fibroblast cells proliferations, and prolongs the inflammatory reactions. Increase of local and systemic TNF-A in the type 2 diabetic mellitus patient at a normal level, fibroblast cells are unable to increase the FEGF productions. Both cause of permanent cell damage even though the environment has had normal glycemia. And then the management of DFU is costly and even some of these drugs have various side effects. These facts then become the consideration to use the supplementation of beta melon leaves to increase the treatment effectiveness. So, the purpose of this study is to examine the oral supplementation of bitter melon extracts on the VEGF serum level to the DFU patients. Our method used is randomized control trial, double-blind, placebo-controlled trial design at Dr. Mowardi General Hospital, Surakarta. This research protocol was approved by the Health Research Ethics Committee of General Dr. Mowardi School of Medicine, University 11 Maret, Surakarta, Indonesia. Patients who fulfill the criteria were those as the DFU patient with a PD score in the range of 1 to 8, age between 30 to 65 years, having hemoglobin level of more than 10 grams per DL, EMT of 18.5 to 22.9, albumin level of more than 3 grams per DL, and brachial ankle index more than 0.6 to 1.3. Length of DM more than 0 to 15 years. Willing to participate in this research and sign the informed consent. We exclude some person with chronic hypoxia sepsis, age less than 30 years old or more than 65 years old, experiencing stress, obesity, consuming alcohol, smoking, and have some comorbidities, diseases like cardiovascular, lung, and immunology. The patient were given the verbal and written explanation. Its patient then gave the informed consent. At the first visit, patients were examined for their eligibility in this study. The eligible patients were further randomized into two groups, the treatment group and control groups. The primary efficacy result is a change in VEGF serum level measured using ELISA method. The measurement of VEGF serum level was conducted at baseline and in the end of week 4 in both groups. The results of the research are presented as follows: number of patients, N, mean, and SD. The non-parametric statistic method was used if the variable studied was abnormally distributed. analysis in the mean difference was conducted between the result of the measurement of FEGF level and the paired t-test and independent t-test. This is how we going through the trial of participants. We exclude 16% that not meeting the inclusion criteria. And then some person resign. So from 50 participants, we only have 30 participants. 15 as the group of intervention and 15 as the group on placebo groups. Result: 30 patients with DFU were participate in this study. And then after 4 weeks treatment, there was a decline from the baseline of FEGF serum level in both groups. However, there was no an impact on FEGF serum level. The result of this study showed no difference at the FEGF serum level in both treatment group and control group. The baseline of initial serum FEGF levels in the treatment group and control groups were found above the normal rate, but after giving the watermelon and placebo extract, there was a decrease. FEGF is a mediator in angiogenesis. The process of active angiogenesis occurs on the third day after the injury occurs. Thus, FEGF levels should have increased on that day. The simultaneous influence on collagenase and plasminogen activator by FEGF will determine a productive environment for the migration and growth of endothelial cells. Carnitine content in watermelon is as a proangiogenesis through the increase of mitogen-activated protein kinase that will activate extracellular signal-regulated kinesis, later on causing the cell proliferation, migration, and endothelial tube formation. This is the baseline table of our patient's characteristics. We use a variable of age, sex, male and female, education, primary school, middle school, high school, and higher education, occupation, and then body weight, body mass index, length in suffering from DM, length in suffering from ulcer, PEDI score, anti-diabetic medicine, and ankle brachial index. And the table 2, we saw effect of watermelon leaves extract on the level of serum FEGF on week 1 and week 4, within groups and intergroups. In conclusion, the oral supplementation of watermelon leaves extract per oral wasn't proven to be capable of increasing the level of serum FEGF to the DFU patients. This study suggests to do an examination for the tissue oxygen pressure and number of adipocyte cells to observe its effects on serum FEGF levels. Okay, thank you for your attention. If you have any question or suggestion, please chat on the chat room that already provided. Assalamualaikum warahmatullahi wabarakatuh.